Okay, I'll get started. Hi, everyone. I'm Dr. Victoria Kirsch, the National Scientific Coordinator of CanPath and Interim Director of the Ontario Health Study. Welcome, everyone, and thanks so much for joining today's CanPath webinar. I'll start things off with a land acknowledgement. We acknowledge the traditional territories of the Mississauga of the New Credit First Nation, Anishinaabe, Wendat, Huron, and Haudenosaunee Indigenous peoples on which the CanPath National Coordinating Centre at the University of Toronto now stands. The territory was the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and Confederacy of the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. With CanPath teams working across Canada from coast to coast, we also acknowledge the ancestral territories that are home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to work on this land. Today we'll hear from Dr. Isabelle Fortier and Anwar Neshba. As a principal investigator at the Research Institute of McGill University Health Centre, Dr. Elizabeth Fortier is leading the Maelstrom Research Initiative. Maelstrom aims to provide the international research community from diverse disciplines with resources to leverage and support data harmonization and integration across studies. The team develops methods and software, generates comprehensive catalogs of study metadata, and supports partner initiatives to manage and harmonize data using data infrastructures adapted to their needs. Anwar is the project manager at Maelstrom Research. He coordinates data harmonization activities for several large-scale national and international research initiatives, including the Canadian Partnership for Tomorrow's Health, the COVID-19 Immunity Task Force, and the Healthy Life Trajectories Initiative. He's responsible for organizing and tracking harmonization workflows, coordinating efforts across multidisciplinary teams, and supporting the implementation of shared procedures for managing and documenting data from partner initiatives. So after the presentations, we'll have time for questions. So please use the Q&A button that you'll see at the bottom of the Zoom window to drop your questions throughout the talk, and we'll get to them soon. And now I'll hand things over to Isabelle.
Thanks. Just to make sure. Okay. So today we will talk about data harmonization. In fact, more and more we have, sorry, I'm not able to change my slide. Okay, sorry about that. So there is an increasing number of research initiatives that are using the methods of data harmonizing data to support their research agenda. That for different reasons. Sometimes it's because they need lots of participants to increase the power of the statistical analysis. Sometimes it's because they want to compare data collected in different countries or provinces or studies. And sometimes it's also to optimize the impact or the usage of the data that are collected by individual studies. So there are different initiatives that are using harmonization. Some will be research network that will be more kind of a group of people that will want to foster the usage of the data. Others, like CanPath or COVID-19 Immunity Task Force, are initiatives that will generate harmonized data and offer access to the harmonized data set. And finally, you have a bunch of more focused projects that will harmonize data across a limited number of studies to generate 1 or 2 papers. So, but what is that harmonization? I think we should stop and ask the question. In fact, is the process that is used to transform data collected by individual studies under a common format to be able to co-analyze the data across different studies, provinces, countries. But the level of compatibility or the level of equivalence that is generated can be different from one project to the other or from one investigator to the other. So let's say you want to do an apple tart. So you will go to the market and find the series of stands that will sell fruits, and will select through those stands the apples that you will need for your tart. But me doing an apple tart is not the same thing as my daughter that is autist and is doing an apple tart. So if she is the one doing the apple tart, you can make sure that all the apples will be exactly the same, cut in pieces exactly the same. While for me, perhaps it will be more a little bit of everything and apples not to cut to so well that will go in the apple tart. So the level of precision, the level of similarities across the studies is key to the harmonization process. So let's take an example. So you have an example of information collected by different studies on the occurrence of diabetes, which could be quite simple. But in the first study, the question that are asked are do you have type 1 diabetes, yes or no, and type 2 diabetes, yes or no. So if you want to generate the core variable across all of the studies, that is occurrence of diabetes, yes or no, that study can be used. So you have type 1 yes or type 2 yes, and you have yes, and if no, it's no. In the second study, you have, as a doctor, ever told you that you had diabetes. Perfect, direct match, you can generate your diabetes, yes or no. In the third study, you have information just about type 1 diabetes. So in that case, you cannot generate the diabetes yes or no, or you can use the study 1 and the study 3 only and use the type 1 diabetes. In the fourth study, the question is, has a nurse or physician ever told you that you had diabetes, but excluding diabetes during pregnancy? Okay, we didn't think about that one. So will that be equivalent or not? And will it change the definition you had when we started the process? Question mark. Second study, diagnosis based on the ICD-10 code. So it's not a question to the participant, it's extracted from health registry. So the quality of the information there is probably different than the quality for the other studies we just described. And finally, the sixth study is asking, as a health professional ever told you that you had diabetes or high blood sugar level? But high blood sugar level, it's not necessary, it's not diabetes. So how to deal with that complexity is what we will address in the talk today. So obviously, if you take like the example data that is already collected, you need to deal with the heterogeneity of the data collected independently without, investigator talking together to agree on a common set of variables. The good thing, as CanPath is doing and did in the past, is sometimes you have groups of studies that will sit down before starting the data collection to agree on a common set of variables to be collected in the future. And that will improve a lot the harmonization potential. And that's effectively what we see with the data of CanPath. So the harmonization potential across the participating study improved a lot through time and is now extremely high. If you go with the retrospective harmonization, like I just mentioned, the harmonization potential across studies will be like between 40 and 60%, while for CanPath, as I mentioned, it's very, very good harmonization potential. So what the Maelstrom group is doing is that in collaboration with our partner, we are developing tools, and CanPath is one of the key partners that is involved that help in the development of these tools. So we developed different tools, so methodological guideline as well as software, etc. We have a central study catalog that can be accessed and is open to and include over 400 studies and is accessible to everybody. And we as well support research initiative to implement and maintain their own harmonization platform. So in collaboration with CanPath, we did different things. So first, we develop and improve the methods and standards and procedures we are using to harmonize data. We develop with the OBIBA group software. Opal, particularly Opal and Mika. Opal being the software we use to store and manage the data, while Mika is the software used for data portal. But more interesting is the new R package that has been put on CRAN and is now available, called Harmonized. That is the package we are using to improve the cost effectiveness of the procedure and the documentation of the harmonization process, as you will see in a minute. So harmonizing data means that you have the data collected by the different studies partnering in your partners of your project, so the material collected. And you need to define the core variables, so occurrence of diabetes, yes or no, for example. Then you need to develop the data processing element that are the algorithm required to transform the collected data under the common data format. You need to process these data, as well as to finally estimate the quality and generate all the documentation that is required to be able to use the data, the harmonized data properly, and make sure that the person analyzing the data has an end everything that is required to understand the procedures and the transformation and everything that was done, and use the data properly and analyze the result of the analysis properly as well. So first step is the study-specific dataset. So before starting to harmonize, you need to make sure you understand the data collected. So, for example, if in one of the studies, some of participants are excluded, let's say a participant with that already had cancer are excluded from the population of participants, you need to understand that to be able to analyze the data harmonized, because you can be really happy to discover that in one of the Canadian province, there is a low occurrence of cancer, but it's because the participants were excluded initially at recruitment. So that is essential to understand. You also need to transform the data as they are collected. So you can receive, extract data from REDCap, from SAS, SPSS. So you need to transform before starting the process, the data in a format that is similar for all of the studies. Then you need to explore properly the content and the quality of the data collected. So make sure that there are no outliers or duplicate of participants, or problem in the skip pattern. Exercise that is done by the studies, but for the person developing the algorithm and developing all the information, the procedure related to harmonization, this need to be understood. Where are the challenge or the problems with the data? So here you have an example. So 3 studies collecting information about alcohol intake of the mother during the year before pregnancy for the first study. So you have different categories and the distribution of the participant for that given study. The second one, it's the use of alcohol 12 months before pregnancy, and the is a yes or no. And the third study, they just have information about ever consume alcohol, not the year before pregnancy, it's during all life. So that's the material you will need to start with. So that's the study specific data. Then you have the core variables. So what you want to generate across all of the studies. So if we take the example of the alcohol consumption, perhaps it can be another definition, but in that case, let's say it's the alcohol consumption of the mother 1 year prior to pregnancy, and it's a yes, no. And you need to define all the variables you will want to generate across the studies. But that leads to major challenges. So, there's a problem with that slide. Sorry about that. So let's say you want to, your variable you want to generate is the weight of the participant. So you need to decide between being extremely precise and having less studies that can generate the variable you're looking for, or being more precise, sorry, and have less studies being able to generate the variable, or being less precise and include more studies. If we take the example of the weight, let's say the first study is collecting the weight measured by the research team in pounds, and you want the weight in kilogram. It's easy to transform pounds and kilogram. You have your weight measured. The second one is collecting weight measured in kilogram, so direct match. But the third study is collecting weight reported by the participant. And we know that participants with very low or very high weight, particularly, will give information that is less precise and lead to potential bias in the variable, in the data collected. So perhaps for me, it's okay to put everything together, and I will then be able to pull data across the 3 studies. But if your main interest is the weight, perhaps you will want to have a measure that is a little bit more precise. So we'll only be able to pull together the data from 2 of the 3 studies. Another thing that you need to think of, and here you are back to the example of the occurrence of diabetes, is the documentation of your definition and what you accept. So if, for example, you have the weight, you need to put in your definition the fact that it's just the weight measured, or both are accepted, or here in the question about diabetes, you need to define if it's the type 1, type 2, if it's both. You need to define if you are including or not gestational diabetes, etc. So all those information are really important to document for the person using the data to understand the data content properly. Another thing that you need to keep in mind is the fact that harmonization is often an iterative process. So to be able to define your core variable, you will need to take into account the way the data is collected. Here in the example, you have information about ethnicity collected by 5 different studies. So and you have the list here are like First Nation, Arab, etc. are all the possible categories that were asked by the studies. And when you have an X, it's because it's used by that given study. So the study 1 had the First Nation, Arab, etc. Second one has the other categories, etc. So that's one thing. The other thing is that you see that 2 of the 3 studies allowed to have multiple selections. So the participant was able to say, I am, let's say, Black and Latin American. So I have 2 origins. For the 3 of the 5 studies, it was possible to have just one choice. So how do you deal with that? So there is no perfect answer to that. And your decision can be different than mine, then can be different from the one of Anwar. In the case of that specific project, what they decided to do is to have distinct variables. So First Nation, yes, no. Black, yes, no. Latin American, Hispanic, yes, no. And for all of the categories that were common across all of the studies, and put together all the other information, which is fine. But for two of the five study, you could have multiple selection, but for the other, no. So it's not perfect, but it's the decision that was taken. And that need to be documented properly. Again, I insist on that because it's really important for the person analyzing the data to understand the decision that were taken. And that's where as well it's perhaps difficult to automatize or to use text mining or AI to be able to automatically generate a variable, because you need really to think about the science and the method behind your decision and document the decision properly. So we have the data collected, we have the core data that we want to generate. Then the next step is the assessing if each of the study, let's say the example of the study 1, study 2, study 3 for the weight, if each of the study can generate the core variable and write the script that will be required to generate the data, the harmonized data. Then, in the example we had before, you will have for the study 1, the script that will, when it's never, it will be no. And when it's all the other categories, it will be yes for the yes, no consumption of alcohol. Second study will be a direct match. And the third study will be impossible because they are collecting information about consumed alcohol during all life. It's not during the last year before pregnancy. So when you have done that, you need to use the data and process and consolidate the harmonized data set. So you will take the study-specific data sets, the definition of the core variable, and all the processing algorithm to use, in our case, the harmonized package to automatically generate the harmonized data. And then what you will obtain is for the study 1, the consumption yes, no. For the study 2, the consumption yes, no, and you see the distribution. And then you can pull or not the data from the two studies to generate the distribution for the both study together. And there will be missing values for the study 3 because it was not possible to generate the variable. So then you are ready to use the data, but you need, as I mentioned, and I insist on that again, to take into account all the information and all the documentation that is produced across the procedures. So let's talk about CanPath a little bit. A lot of work has been done to harmonize the CanPath data set, and thanks to Anwar and to the team in Maelstrom, but as well to the CanPath cohort that were really, really, really patient with us and really good in improving the potential to harmonize the data across the study through time. But behind the scene, it's a lot of work that is achieved. So if we go back to the process, first was the understanding the data collected. As you see here, the date of the start of collection is a little bit different across all of the CanPath studies. And the selection criteria of the participant are a little bit different. And the wave of data collection are different as well. So some of the studies will have more or less wave of data collection or longer period of data collection. So first thing that is important for the harmonization and for the user as well is to be able to understand that heterogeneity. heterogeneity that at the end of the day allow to generate the variable across the studies, but it's important to understand from where the data are coming. I had the example of the exclusion criteria for some participant. That is a real example that is present with CanPath. So the second is the definition of the core variables. So here you see the distribution of the number of core data to harmonize across the different cohort for the different wave of data collection for CanPath. And then it's the harmonization process. So you have the 4,500 something core variable, but behind, because it's a lot of different wave of collection, you have 66 data set that were used to generate those variables. So in total, over 36,000 variables, study-specific variable generated. And you see the distribution of the number of participants for each of the data set. So using again, we have the collected data, the core harmonized data, and then we generate the harmonization potential across for each of the variables. And here you see a good example, I think, to illustrate the precision and or not of the variable. So in the health and risk factor questionnaire at baseline, we generated different variables for the siblings. So the number of brothers and the number of sisters that you see that cannot be generated across all of the studies, because some of the study or the data set, for some of the data set, the question was just about the number of siblings, but they didn't separate the number of sisters and brothers. So if you really want to have the number of sisters and brothers, you will be able to to co-analyze the data across just the data set with a check. For the number of siblings together, you have more potential to harmonize the data, but not for one, because for in one of the data set, the question was 0, 1, and it was more than 12. So we generated as well another variable that is categorical. So it's 0, 1, 2, 3, up to 11 and 12 and more. And for that specific variable, you're able to have all the studies together or all the data set together. So depending on what you want to use in your statistical analysis, sometimes you will want to use something more precise and have less studies, and sometimes it's okay to be less precise and have more studies. The number of siblings is a good example. It was not always possible to generate several levels of heterogeneity or not or of precision, I mean, sorry. But if you see that there are some variable of interest that you will want to have, do not hesitate to come back to the CanPath team, and we can try to see if we can harmonize other definition of variable if it's relevant for you. So the other step that is really important, and I didn't talk about it a lot before, it's the validation and the versioning of the data that are generated. So here you have a good example of an error we catch. It was a long time ago, but it was with the sitting height and what was the distance of the measured for different data set. And you see that for some of the data set, for 5 of the 8 data set that we used, The average was around 1.3 meter height, but for others, it was approximately 90 centimeters. And that was before there was an error, because there was the truth is around 90. So there was an error in the calculation. The data that happened at the time of the data collection, so that we were able to discuss with the studies and correct the error. So now the right information is in the harmonized data set. So that is one thing. So making sure that everything is validated. It's not only to generate the harmonized data set, it's as well to validate and make sure that the data is adequate across the studies. And here again, perhaps you will find errors. We cannot see everything. And if it's the case, it would be great to have feedback from you. And lastly, the versioning of the data. That is the data set, that is extremely important to be able to go back, because as in any cohort, the data evolve through time, there we correct errors, etc. So we need to generate regularly updated version of the data set. So then it's the use of the data. And here you have different tools that can be relevant for you. Obviously, you have access to the data set and the data dictionaries that goes with the data set. But you also have the data portal and different reports that are available to help you in the usage of the harmonized data. So, for example, in the portal, you have the description of the study characteristic. You also have the list of the harmonized data set and the description of what is included in each of the data set, and the harmonization potential that is available online that can be very useful to estimate the interest or not to have access to some variable. Then you have for each harmonized variable, the description of the variable and the distribution of the pooled data set across all of the studies. But you also have the access to the distribution of the participant for specific studies. Then you have as well in the portal a search engine that can be used, where you have the list of variables, but that can be used to select a subsample of variable that you will then add to your demand for access to the data. This is a variable that can be searched by different selection criteria, but that can allow as well to generate a comparison table where you will see through each data set the variable collected at each time, the variable not collected, sorry, harmonized at each time point or harmonized data set. As I mentioned, things evolve through time. We now have the tools and the method to do the description extremely well, but we are planning to go back to the baseline data collected to try to improve the documentation, because it's a learning curve. So what we have currently is not perhaps, or the documentation that we have currently is perhaps not as good as the one that was generated 10 years ago. So finally, last thing, that you also have some reports that are accessible. I was discussing or presenting the data processing element that is including the harmonization potential, but as well the script used to transform or to process collected data under the harmonized format that are accessible for all of the variables. And you also have some reports that are particularly helpful to look at the data collected. And hopefully all that can help you to use the data. And again, I insist, but if you have in mind things that should be improved or can help you in the usage of the data, do not hesitate to talk about it with the CanPath team. So thank you. And if you have questions, we will be happy to discuss the different points.
Great, thanks so much, Isabel. Okay, so now we'll move on to some of the questions that have come in. I think people don't realize, it's until you sort of see all the work that it's involved, you don't realize what a huge undertaking it is to harmonize across different data sets. So the first question we have here says the harmonized data provides us some variables for one subject, for example, on alcohol consumption. However, depending on the variables selected, for somebody's particular analysis, is the sample size different? And I think you touched on this later on, that it's not that you drop a subject, but that it might be missing for a particular variable. Is that correct?
Yeah, absolutely. Like we have seen, depending on the variable you select, you will have an harmonization potential that will be different for each of the variables. The good thing is now the harmonization potential is better if we compare to the baseline. But the bad thing is that let's say you have the definition for alcohol consumption and for smoking. That doesn't mean it's the same studies that will be able to generate the variable for alcohol consumption and the variable for smoking. So at the end of the day, to calculate your real sample size, you need to define your variable and calculate, and that can be done relatively easily, but calculate for the list of variable you have the total number of participants that you will have, and that can be relatively low or relatively high depending on the variable you are selecting. So perhaps you would like to have the variable, the number of cigarettes smoked, but that would mean that you will not be able to include 2 studies. But if you have the yes/no smoking, you will be able to have all of the studies. So you need to play with the variable you're selecting. And yes, that will change the total number of participants that can be included in your analysis. And that's a really important point, and we need to be realistic when we are calculating the sample size.
Right, and sort of related to that, how do you balance the consistency across data sets while preserving, some of the unique characteristics across and the detail? Like, let's say the question asked was, have you ever been diagnosed with cancer? And then one question asks for specific subtypes, one study, and another one just has a yes, no. Is that detail lost from the first study?
No, what we try to do is to be as precise as possible. So I think the example of cancer is a good example. And correct me if I'm wrong, Anwar, but I think we will have the yes/no cancer for all of the studies for sure. So we were trying to have a level of precision that was not necessarily as precise, but that will still allow to generate some information for all of the studies. Then you will have the breast cancer, prostate cancer, etc. That will be, I think it's accessible for a lot of the studies. I would perhaps not 100%, but the type of cancer is as well possible. But the way we did it is a little bit like the example of ethnicity. Instead of having, breast cancer, prostate cancer as one variable with several categories, which would have been more difficult to harmonize because you needed to have exactly the same categories for all of the studies. What we did is that we created separate variables. So breast cancer, yes, no, prostate cancer, yes, no, etc. So to be able to have a higher harmonization potential. So not fixed categories, but the yes/no variable that you can use to recreate your categorical variable if you want, but at least you will have the information for a higher number of data sets.
Okay, perfect, thanks. And another attendee is asking, when you receive data sets to harmonize, are they raw data or are they de-identified when you receive them?
It's a little bit different. De-identified for sure, but we are working with a lot of different networks. But in an ideal world, when we use data set, we don't want to see the name or any sensitive information. That's the way we are working. But the data are raw in the what we would prefer to receive is data that are already cleaned a little bit, at least, with no names of the participants, obviously. And but it's the collected data. So raw data, yes, but without sensitive information, and ideally cleaned a little bit, because it's mainly the studies that are collecting the data, the staff that know where could be errors or outliers. So it's better if the first cleaning is done by the participating studies.
So names are excluded, but dates of birth and health card number, can that be included in a data set?
It depends on the network, but ideally we prefer to see nothing.
Right, okay. Okay, Shiraz is asking, it says, great presentation. My question is related to harmonized package, the harmonized package developed by your group. How has it been received by the research community, and can we expect more updates to this tool?
There will be an update. They are working this week on upgrading the version of the package that is on CRAN. The major update there is that the report, the visual reports and the report generated will be like night and days. It will be like, very, very far more useful than before. So there's a major upgrade that will be done this week. And as well, an upgrade of the website of Harmonize that will describe better the way to use the package. So we are hoping that it will help the users to facilitate their life, the life of the users of the package.
Thank you. Another attendee is asking, if you have a variable that has the same category, yes or no, but one is from a lab test confirmation and one is from self-report, is this considered to be the same in the CanPath harmonized data set?
It depends. It depends, and the way we are working is that there is a committee. It's not just Anwar or just I, but when we are defining the variable, let's say the lab test, there will be a committee that will discuss the balance between the precision and all that, as I described, and will define the variable. Generally, Anwar will propose solution, and when he has a question, will address the question to the committee. It's less a problem now because the questionnaire are so similar across the studies that the challenges are less there than before, but it's still the case. If there are some scientific decision to be taken, it will be discussed as a committee. That being said, sometimes it can be yes, sometimes it can be no, the answer. But what is key is that we will document the decision in the variable definition, so it will be clear if it's everything or just the lab measures. So it is coming with the description, with the documentation coming with the data set, the access to the specific definition and decision that were taken for that given variable. But there is no, in some cases, I remember that we said it was okay, even the example for the weight. In some cases, we harmonize weight measured and weight reported, and in the other cases, we didn't. So it really depends on the research question and the scientific context. The difference with CanPath and with the given project that is really specific to answer a specific research question is that CanPath is built to be as generic as possible. So perhaps decision could be different if it was just one research project harmonizing 10 data across the CanPath studies. In the case of the CanPath platform, it's in an ideal world better to be as open and as generic as possible. So the only thing that we could do is to improve, always continue to improve the documentation and the information that is provided to user. And they can change the variable, or they can create another definition as well. That's okay too. It's like a core, things evolve through time. So if someone needs a new variable with another definition, that can be added to the next update of the data set, no problem. But for that, we need input from the users, because we did our best when we built the initial list of variable, but perhaps need change, or there are different or errors or new needs that can lead to the creation of additional variable to be added to each of the data sets.
Great, thanks. And so during the data collection stage, what should researchers keep in mind to help the data harmonization process?
Right. You need, if you want to harmonize, if there is a group of studies that want to harmonize, in an ideal world, the data should be collected the same way. So perhaps one study as a investigator has an interest for I don't know, environmental exposure, and another study they have an interest for nutrition. So additional information can be collected for environmental exposure in the study A, and for nutrition in the study B. But ideally, the core question should be exactly the same, and the harmonization potentials, the target should, we are working with a group, the LT initiative. They are collecting information in South Africa, in China, in India, and in Canada. So the first study, it's a little bit like CanPath. The PIs agreed together to collect common information, and on the core set of variable to be the same across all of the studies. But there were some problems, let's say for income. In some of the countries, it was the number of cow that the participant had, and in the other country is the family income before tax. So it can be very different, but we still agreed, even if the information is collected a little bit differently, for that information to be like estimated, the potential for harmonization is estimated prospectively. So we make sure that it will be possible to process the information collected under the common format afterward. So a good example is the fact that in Quebec, the education level, we have CEGEP, so it's the categories for education need to be different than in other provinces perhaps, but we can still have the 5 categories that are perhaps the categories for the common variable, even if the information is a little bit different. So it's, I would say, in an ideal world, you use the same questionnaire. Second layer is that you change the question, but you make sure before starting the collection that the core variable will be able to be generated. And that is the key thing. So to estimate the harmonization potential in advance. Sorry, you're muted.
There are many AI tools that have been developed and applied in health research. Do you foresee how these might impact or support the process of data harmonization?
It can support, but it cannot be totally automatized, I think, because there are too many scientific questions and methodological decisions that need to be addressed. Let's say if I have different ways to collect information, the data dictionary often that are provided by the study. So the information about the data collected sometimes is not really good. So for example, you know, I have a cat, yes, no. You have a variable and the label is cat, but I don't know if the variable is I have a cat, I like cat, or I'm allergic to cat. But if you receive a data dictionary with cat, yes, no, the best AI tool in the world will not be able, yes, the tool will generate the variable, but the meaning is not the same. So you need, I think, the balance between using those tools to perhaps automatize some of the data cleaning or the variable naming or some aspect of the harmonization process that can be supported by AI, but generating automatically variable with AI without someone thinking about all of the issues I just mentioned, I think would be dangerous scientifically.
And do you think AI could help sort of with maybe some of the executive summaries of a data set, sort of higher level thinking?
Those, yes, sure. But it's more the scientific decision. If we're going back to the example of ethnicity, we discussed that variable for hours. AI could generate zeros and ones, but understanding how it was generated, the reason why, and all those things. So it's more the decision making that I think still need to be done by a human. Perhaps one day AI will be able to generate everything, but we're not there yet. But to automatize some of the reports and all that, sure. I think the harmonized package now can be used to generate a lot of these reports, but improving, yes, for sure.
Okay, and then we received a follow-up question to that issue about removing identifying information from a data set. So if no identifying information is included in the data set, how would you know if the same participant has participated in multiple studies and as a result is included more than one time in the different studies?
Yeah.
Or is that not something that you consider?
In fact, what we are doing is that we're working with the studies to generate random, not random, but new IDs, and Anwar could answer to that better than I. But let's say the study have the name and all the information and a given ID, but they generate another ID for us. And we make sure that, and we are using that ID. All the harmonization process are focused on X number of studies and really targeted. So we are not harmonizing all of the studies of the world at the same time. So the problem of the IDs is less present. Like for CanPath, it's different provinces, but could it be possible that one participant that started at Carthagène one day in Quebec moved to another province and was recruited there? Yes, sure. But I think it's relatively rare. But we are just using the ID of the studies, but generating new IDs for us.
And I mean, the studies are collecting information on participants, but across all the questionnaire, they're using the same IDs. So we're able just to retrieve each participant across the questionnaire, but across different studies, I mean, the information and the identification would not be the same. So of course, we will not be able to retrieve this particular participant. Yeah.
Right. Okay. So, I mean, thinking about harmonizing, studies of the world, do you see harmonized data contributing to global or cross-jurisdictional health research over the next decade?
Absolutely. It's already happening, and more. We Anwar generated a kind of graph of the number of publication involving or using harmonized data, and you see really an increase, a clear increase of the usage of the harmonization, with all of the studies now starting to be more and more fair, opening access to the data, perhaps not transfer the data collected elsewhere, but there are some tools that can be used to do federated analysis of data. But that is already happening.
Okay, great. Thank you so much. I think that's the end of our questions. If you have a question that you haven't asked online here, feel free to reach out. We also have CanPath office hours, and there's a link to those in the chat if you want to sign up. And you can also email us at info@canpath.ca if you have any questions.
Great, thanks. And perhaps just to finish, I would like to mention that we need your feedback. Sometimes, we are generating harmonized data, we are generating reports and tools, but we do our best, but having some feedback from the users of what is missing, what you would like to see, can be extremely helpful to improve the content of the data, harmonized data first, but as well the content of the tools and that we are providing. So do not hesitate to contact the Access Office or Anwar or us at Maelstrom if you would like to comment or ask for great things to be added to the next version of the tools. Thanks.
Thank you.